I always preface this. Janelle Preston, who usually is the one that facilitates these sessions, is at the Division for Early Childhood conference down in New Orleans. So she's in the nice warm weather enjoying herself. So as I usually introduce, we'll begin JV hour now and share these opening slides. We've got a great presentation. Ilse Dekoeyer will be talking to us today. But to get started, just welcome you all to the Time to Act Mental Health Echo project. Go ahead and remind you that this is recording. By being on this presentation, you're consenting to be recorded. If you don't want to be recorded, you can go ahead and disconnect from the call now. It is an interactive community. We do like to have interaction. Talking to Ilse before this session, she wants this to be an interactive presentation, so please feel free to interact. We'd love to have you have your cameras on and to ask any questions, either through the chat or by raising your hand, and Shana will monitor the chat as well as the hands to see if there's any questions. We'll go ahead and answer those as they come up. We also talk about the case narratives that we have at the end. We're always looking for ways to help people with difficult cases they might have to be able to answer those through using the joined expertise of everyone on the call. We remind you that if you are sharing either a case or if you're asking specific questions about people you know or situations you're in, please make sure we're careful not to identify people who haven't consented to that. So please be aware of that as you share experiences or ask questions. We'd also ask that you remember our structure is a didactic speaker, followed by a case presentation. And then one of our main goals with this ECHO network is to expand our professional network. So please reach out through the chat or take down information from the chat if there are people you'd like to connect in helping to expand that professional network. We'd ask you, if you are on, if you would rename your profile to have your name and information about you, where you're from. We love to have emails put in the chat as well, so that people, if they do hear a comment or have a reason to get a hold of you because of something that you've said or something that you have shared and they want more information, we'd love to have those emails in the chat as well. There is the raise a hand feature. It's usually at the bottom of the screen. You can click on the reactions, I believe, and raise your hand. The other way is just to, at a break, ask a question or put it in the chat. If you do want to register, or if you know people who you'd like to share this with, the time to act at aggies.usu.edu is the place to go ahead and sign up or pre-register for these courses. We'd encourage you to reach out to those that you know that might be interested in these courses, to share that email and to get pre-registered. The more people that are on, the more information and knowledge that we're able to share, the better. For credit for this course, some professional organizations will allow you to utilize these courses as continuing education type courses. If you'll fill out the survey that Shana will be popping into the chat at different times during the session, you fill out that survey and then we will send you a certificate of completion for that particular day. You can then use that to send to your professional organizations to consider for professional education credits. We do keep our information on the Canvas platform, and that's our learning platform. You need to register for Canvas, and you can email that same email, timetoact@aggies.usu.edu, for instructions on how to get registered, and then you'll be sent a link to be included on that Canvas site. Any questions, you can reach out to us with the asterisk in front of our name. There's also on Canvas, there's a discussion board that you can ask questions on or share information on as well. We do have case studies at the end of each session. We encourage people, if they have questions about any topic relating to mental health, to please contact us and let us help you get that case study. We are happy to do that case study for you if you're not comfortable being in front of an audience. We do receive a lot of valuable feedback from the other session attendees as the questions are answered in those breakout sessions. These are our social media presence: Facebook, Instagram, LinkedIn. If you'd like, you can scan the QR code and that'll take you to our particular social media sites. I would encourage you to become involved in those as well. Also keeping in mind, this has September 18th as our next session. It's not September 18th. It's actually October. This is the JV hour right here. The next one is actually on October. It would be the 16th. We'll have another session. So all the informations and slides are kept on that Canvas site. So if you have any questions or you'd like to take a look at any of the information from today, that is on the Canvas site. So with that, we'll go ahead and introduce Ilse Dekoeyer. She's our presenter today, and we'll turn the time over to her to give her presentation.
Yeah, so some of you on the call may know me, some of you may not know me yet, but I am currently the Early Relational Health Specialist at United Way of Utah County, the Everyday Learners Program, which includes Help Me Grow Utah. And I've been working for Help Me Grow since 2015. For a long time, I was part-time because I was actually my main time was actually spent at the University of Utah, teaching there at the psychology department, mostly in infant psychology. And I've been very involved for about 20 years in the infant and early childhood mental health movement here in Utah. So I've mostly been learning a ton about what babies need, what young children need. And one of the main things that they need, of course, is relational safety, early relational health, that security with parents, co-regulation of their emotions, and they cannot get that when their parents are not emotionally available for that. So part of this field of infant and early childhood mental health is actually also the parental mental health. Today, I'm going to focus mostly on how can we support parents who are struggling with perinatal mental health conditions by listening, screening, and referring. And so first we'll go into a little bit what the various perinatal mood and anxiety disorders are. And then I'm going to focus on what can we do, especially if we are not mental health professionals, to support parents with perinatal mental health struggles. And lastly, I'm going to walk you through the basics of the protocol that we use at Help Me Grow Utah. Since we are not mental health professionals, our main job is to refer, but we do have a protocol that may be helpful for you as well in your practices as you work with parents who have struggles with perinatal mental health. If through the talk you have any questions, please put them in the chat or raise your hand or just speak up, because I will be happy to communicate with you as we go. So this is a cartoon that I have found a couple of years ago. You may have seen it before, but I think it's so poignant because oftentimes, even today, when there's so much more awareness, I think struggles with mental health around the time that you have a baby still are kind of secret and unseen. So, you know, the mom may say, "Oh, I'm fine," when someone asks, "How are you doing?" And meanwhile, she may be thinking, "Oh, I don't know how to cope. I don't know what I'm doing. I don't recognize myself. I'm irritable. I'm unhappy." And they may not express it. And for many years, we haven't really asked enough in order to bring out these feelings and emotions that are right under the surface. But luckily, in recent years, there's more and more awareness now. And we used to talk about postpartum depression mostly. But in recent years, that has been renamed and kind of broadened into the term perinatal mood and anxiety disorders, or PMADs. And those include depression before or after giving birth, bipolar disorder, anxiety disorders, PTSD, OCD, postpartum psychosis. And that last one is really rare. Psychosis, that's really where things get dangerous. That's only about 1 or 2 in 1,000 moms postpartum who basically lose touch with reality. And this is where there's a real danger that the mom may harm herself or her infant. But in the other ones, so for instance, in depression, moms may still be afraid that they might harm themselves or their babies, and we still need to watch out for risk for that. But it's mostly in the postpartum psychosis that there's a real risk because they cannot really distinguish reality from what's going on in their minds. So there's not an awareness. And in the other conditions, there's an awareness. So all of these need support, but that last one may need immediate intervention and referral to an emergency room, or if there is specialized mental health care for that. So in total, all of these different conditions are estimated to affect at least 11 to 21% of women, but it's much higher if people face risk factors. So in those who face poverty, or women of color facing discrimination or lack of resources, those who struggle with domestic violence or other abuse, those who have experienced childhood trauma, all of those experience much higher rates of perinatal mood and anxiety disorders. And that can be even up to half of all of those who experience that. In Utah in 2021, the PRAMS survey found that 43% of moms who were pregnant at the time indicated symptoms of depression and or anxiety. So they can occur together, of course. We haven't had as much research or attention to perinatal anxiety, but it's actually more common than depression symptoms. So here's a study that was done right earlier on in the pandemic, so published in 2022. Actually, this puts together 18 different studies across the kind of beginning through like the first few years of the pandemic, and found that about 27% had significant symptoms of depression, up to 60% in some studies, and 42% had maternal anxiety symptoms. So yeah, we still usually speak about, postpartum depression, but anxiety is very common. Now, you may think, well, isn't it normal to be anxious when you're having a baby, and will I be able to take care of this child? Will I have enough resources? Will I have enough support? What if I don't know what to do? And you're right. Yes, it is very normal to have anxiety. However, the symptoms that we're speaking about are to the level where they interfere with people's everyday lives and with their ability to enjoy parenthood and to also parent that infant optimally. And they found that in the pandemic studies, the depression prevalence increased by half and anxiety almost tripled. So before the pandemic, it was 17% who had depression symptoms and 15% anxiety. So yeah, definitely the pandemic made a big difference. Of course, it was so scary to have your baby, not knowing how COVID might affect the pregnancy, going to the hospital alone, then being isolated at home. So all of those made it even harder. And even before the pandemic, we had a lot of isolation of new parents, not enough support for new parents. And from the child's perspective, these types of mood disorders and any heightened, very high levels of stress are a risk factor for their development. So during pregnancy, the child's nervous system and the entire child, of course, is being formed. And when there are high levels of prenatal stress or anxiety or depression, then this affects the so-called HPA axis, hypothalamus, pituitary, adrenals, which increases stress hormones, and it tends to make that child more hypervigilant to stress later on, and dysregulation in their emotional regulation, their regulation of attention. So several long-term studies actually have found that this prenatal stress and anxiety and depression are related to later higher likelihood of ADHD in children or other hyperactivity, as well as emotional dysregulation, such as in behavioral problems. So we know this is a risk. And then as well, after birth, then these mood disorders can affect how the parent is present with that baby, how confident she feels, and how well she can co-regulate those very strong emotions that babies have with the baby, meaning when the baby's very young, we need to be there and soothe the baby so that they can feel that those very strong and chaotic emotions, yes, they feel like it's the end of the world, but when you have a calming parent there, then you feel like, oh, and then I'm calm and I'm okay again. But a parent who is dysregulated herself or himself or themselves, they cannot really calm down those big emotions very well. But when I'm telling all of this, of course, this information can add even more stress to parents who are already really worried that they're maybe not doing a good enough job, and they also need a co-regulating other. By the way, I will mostly be using women and mother, but I will acknowledge that this spans the whole range of people identifying more or less as female, as well as fathers have been not much in the picture so far, but luckily recently there are more resources for fathers specifically. And of course, the partner of a parent who has perinatal mood disorders also needs to be informed and to have support to know how to cope. So we need to provide co-regulation to these parents and acknowledge that these mental health disorders and struggles are the main complication of pregnancy and childbirth. In recent years, luckily, we've seen more and more people sharing their parenting journeys, their struggles, their lived experience. And through all of this, like social media exposure, sharing in videos and such, we've seen a lot more awareness, as well as kind of permission to open up conversation about these things. So that's, I think, really helpful, just because it's always been there, we just haven't talked about it. And now, again, it's even more challenging since the pandemic happened. So what does perinatal mental health currently look like? So the system is pretty scattered. And the system, like, for example, doctors and therapists may not speak to each other or communicate what is going on in their separate offices. Follow-up may not always be good. So we all have good intentions, but it is really important to follow up. However, people who are depressed, they may not want to pick up that phone. They may not want to, take initiative to call or contact another provider. It may be really difficult for them. And many providers, I'm sure you can relate, we are all so overstressed. We don't have time. We don't have, resources oftentimes to do really good follow-up and check in with that parent to see if they found and connected with resources. And then also there's not enough mental health resources available. And the resources that we have are usually not very culturally diverse. So it's kind of like, we have therapy, but it may not always be concordant with your cultural background or your personal preferences as well. And then there's many gaps and barriers, especially for those populations who have been disadvantaged historically. So I don't know if anyone wants to comment, or what do you think? Have you encountered any of these, or have you encountered any other barriers? So I would love to hear or see in the chat, like, what barriers have you encountered when you were trying to connect to perinatal care, to mental health care? Yeah, I would love to hear from you. So this study, also by the Utah PRAMS survey, this was done a little bit longer ago in 2009, and they found that 60% of those women who had postpartum depression symptoms did not seek help. And seeking help was more likely postpartum when they had already sought help during pregnancy. So it's really important to start asking them during pregnancy so that we become accustomed to talking about these things. Also, interestingly, if they had a NICU baby, which, usually comes with more people that you can ask and get support from. And the last one surprises me also because rural areas don't have as much in terms of resources. It's typically more challenging, but apparently they were more likely to seek help in this particular study in Utah. And then also not seeking help was 12 times more likely for women who were not white. That is huge when there's already so little help seeking going on. And especially specifically Hispanic women were 3 times more likely to not ask help, and also those who had experienced emotional abuse. So yeah, I haven't checked the chat, but I'm curious. There's comments. Yeah, waiting lists. Yeah, so basically those two are very similar, that even if you know providers that you want to refer to, then they may not take clients, or they may have long waiting lists. Yeah, exactly. So in an ideal world, what would perinatal care look like? Again, I want to hear from you. Please put in the chat, what would you like to see if you had an ideal world and you wanted to help these parents? I'll wait a bit, and then I have my own list, but I'm curious to hear what you guys think. Yeah, support. Yeah, in this country, so I'm originally Dutch, and it actually has gotten kind of worse there as well. But in the Netherlands, after birth, there are specially trained nursing personnel who come to your house, and they take care of you. They make sure that you rest, that you can breastfeed. They actually do your dishes and your laundry. They take care of your other kids if you have them, and that way you don't have to worry, and there's already so much that is stressful, like learning how to breastfeed, for example. Yeah, so let's see what else you guys are saying. Screening. Yeah, most will not ask. You're right. Yeah, making connection to mental health might be stigmatizing. And then we also work here at Help Me Grow with parents who may not have all of their immigration papers in order. They're really scared of connecting to any resources. Yes, social support. I'm so glad you guys mentioned that. Social support is really the biggest protective factor. And I've been in both in professional groups, as well as I've just found a research article with high-risk moms, and all of them kind of say something similar. Like, what we would love to see in an ideal world is a center where you can just walk in as well. You don't even have to make an appointment, although probably in reality you probably have to. It would offer healthcare, and it would also offer alternative healthcare that has research base behind it in reducing anxiety, stress, and or depression, including yoga, mindfulness, massage therapy, exercise, acupuncture, nutrition support. It would have high quality childcare so that you could go there and have a good place for your child. Social support in terms of just hanging out with people, as well as more formal support groups and therapy. And it would be respectful for all culture, all people, and the environment would be like a spa. So we're probably not going to get there anytime soon.
But if we did, Ilse, what a wonderful description of such a healthy site that is not, would be one of no stigma, no criticizing, the whole focus on health and meeting other mothers, being with other people. And that's what I have found in trying to make those referrals with very stressed mothers. They're afraid to make that next step of outreach and fearful of going to mental health, and also just the energy it takes to go to mental health. You have to groom, you have to get a babysitter, you have to make sure everybody's okay, you have to have transportation, and then to walk in to mental health if you can get it paid for. There's so many hidden behaviors you have to go through that you may not have the energy to do. just to get ready to go.
Yes. Oh yeah, I remember that very well from having my own baby. It was so hard. And the first appointment I had with my physician, and I consider myself, you know, privileged, but I was late at that first appointment postpartum, and they sent me back. They're like, well, too bad, you're too late. And I just broke down. I'm like, I can't cope. And then yes, there's so many people who don't even have transportation. And then all of the barriers for the energy, all that you said, Susan, that's really awesome. Yeah, I totally agree. The care that we have that's out there that is good is still not, it doesn't work for everybody. So in this focus group study, they asked what would be the optimal way to treat perinatal mood and anxiety disorders. The majority wanted a community-based center where you could just drop in for counseling. Because so if there's lack of transportation and all the things that you just mentioned, then they just, you know, can't access most of the current resources. So some positive developments is that there is much more awareness, as already mentioned. There's many initiatives now of grassroots groups, as well as government-related groups and statewide groups that are taking initiative to gather resources, to put in place local initiatives that work for that place. And the Biden-Harris administration actually has recently launched this maternal mental health task force, and they have put together, they had tons of committees working on creating, I still show them here, these recommendations. So to build an infrastructure that prioritizes mental health, as well as making the services more accessible, affordable, and equitable. And so one thing, for instance, that is more and more applied is peer support and community health workers, who are people who are they can connect to particular communities that look the same like them, that have the same type of cultural backgrounds, and that are able to help people connect and find the resources and actually go to the resources. So that's one example. And then using data and research, promoting prevention and engage, educate, and partner with communities. So what they're doing is they're putting more money into Medicaid, for example, to help do the screenings more all across the board, as well as what I really love is they're lifting up lived experience more, so that we, I think we've been so top down, you know, like looking at the research and then how should things be. But from lived experience, we know that a lot is not working. Okay, actually, so maybe Kurt or Shana, you may need to give me like a 10-minute warning because I tend to go a little bit long and I want to make sure that I have enough time. So next section, what we can do if all else fails, you know, we can always start by listening. And that's maybe easier said than done, but in many of these qualitative studies, it has been found, especially in the healthcare system, where there's just no time, right? There's no time. There's a couple of things that the doctor looks at. And sometimes they may even give a screener, but then not really follow up or not really ask that mom, like, how are you feeling? You know, wow. And then acknowledge, oh, yes, that is just so hard. You know, you're still recovering from childbirth and you're trying to do your best for your baby, but you're exhausted. And just acknowledging, seeing them makes a world of difference. You can use you're listening with all of your senses. So with your eyes, your ears, your sensing ability. And in order to do that, to show up like that, to offer your patience and your listening ear, even if you have only, 3 minutes, it can still help to pause and really acknowledge and be with that parent. You need to also take good care of your own self. So research found that so-called listening visits are helpful. I will have another slide on that. Social support, you guys all mentioned it, and they find that even when moms said that they felt really stressed, so they felt stressed, But when they actually indicated they had higher support by their partner, their stress hormones were lower, as well as the baby's stress hormones were lower. So it buffers those stress hormone responses. Women who cried more had lower levels of depression when they experienced high support from their partners. This is a peer support program that just called moms on the phone through other women who had gone through these experiences, and they helped reduce depression symptoms. So 25% in the control group still had symptoms after 12 weeks, but only 13% of the intervention group. Listening visits, those are done by nurses or home visitors or physician assistants, all non-mental health professionals. So similar, but they go to the home and they listen. They figure out with the mom together what we can do to solve her situation and what works for her, and then getting them to those resources. As well as follow-ups have found this in diverse samples. And yeah, in only 8 weeks, that made a big difference. So the participants said things like, it's really helpful to get things off my chest. It's non-judgmental, and I could find solutions to my own problems by being listened to. So we could increase social support, of course, by tapping into her existing social network. Oftentimes that helped me grow. When we talk to parents, they will say, yeah, my sister lives close by, but I don't want to ask her. Or, yeah, I have this friend, but I haven't talked to her in a while, but I thought maybe she could help me. So often it's listening to those possibilities that they already may have access to. They're just not using it because they may feel like they're too much, or they shouldn't ask. So if we can support them and say, you know what, let's have you ask, and then check in with that mom a couple of weeks later. So support groups can be helpful, but again, there could be barriers to making it the time, but there's more and more online ones. Actively engaging the dad or partner as well, and encouraging to utilize what they have available. So this was a qualitative study that asked how pregnant, this was during pregnancy, women in LA, how they could be helped, and then they just gave all of these suggestions. I'll share the slides so you can review those later. So then inform, and let's see. That relates to normalizing, recognizing the symptoms, so it's always helpful to give a handout or a link that tells them, like, these are the symptoms. Many people experience this, and there is help. There's a way out. You're not alone. Then I don't know how many of you have seen these, but we love the Sunshine or Bailando handouts, and the let me see, the Department of Health and Human Services now actually has them. Can you see my website screen now? Yeah, so Sunshine, and then, in Spanish it's called Bailando, and they actually have this in 10 different languages now on that website. Yeah, so basically it's things like, the basics of what we tend to call self-care, including nurturing yourself, exercising, nutrition, all the things. And it's helpful, I think, when we work with this, we try to focus in on just a few and to really ask what works for them. So yeah, again, I gave the example of the support, but also like, what helps you feel better? And then if mom says, well, I used to go for a run, but now I can't, then we try to help her figure out solutions so that she could still go out for at least a walk outside. So it's very individual for each person, what works for them. So so those are great. They also have several other really good resources on there. So Postpartum Support International is on there, and they have some really good support groups online. They also have a number that you can call, just a helpline where you can just be listened to, be heard, again, work through your questions. And yeah, the support groups are for a wide diversity of parents. It's really awesome, and they are online, so that's a lot easier for many people. PSI Utah, that is the Utah chapter of Postpartum Support International, and they're an awesome group. They have monthly meetings that They usually have an awesome presentation. They share local support groups, and when they are, a lot of the therapists actually offer free support groups, or they try to offer multiple times. So therapists are really motivated to help. Again, it's just the match between the needs and the resources. And then there's Maternal Mental Health Referral Network. And again, I may need to stop sharing and reshare, so I'll do that just in case. Yeah, so this one, the DHHS is, they are collecting resources specifically for any region that you are in, and then things like support groups or therapists, you can search by your insurance type, etc. So they're really good resource as well. So again, I'll stop sharing and reshare in order to. So I hope you can see my slides again. And I'll maybe go a little bit faster through these so that I can share a little bit about what Help Me Grow does. So yeah, the Edinburgh is the most common screening tool, and most of you may be aware by now, but it has 3 items that do ask about anxiety specifically. So sometimes you see a high score, and most of the items that are endorsed are those anxiety items. And then you can see that anxiety is probably the main concern. It also assesses self-harm on question 10, so that we know the risk for that. So of course, so the letter T, I put treat or refer, because it depends on your professional background, what you do in this, for this, of course. So physicians, they will usually weigh if pharmacological interventions are a good option. Typically, that might actually better to stay on your medications rather than come off of them, because that can increase, again, your symptoms. But many moms are very concerned about taking medications. So always send them back to their doctors before they try to decide that on their own. And then which resources are already in place is also really good to know. And then I already shared a couple of the other referral sources on the other slide. And I like some simple practices that we can apply that can actually help both the parent and the baby, because, for instance, things like touch, like baby wearing, skin-to-skin contact, or baby massage can release oxytocin, which can help you feel calm, the peace and calm hormone. So not only for the child, but also for the parent. Lullabies, it's kind of an old art that we are forgetting. A lot of parents don't sing lullabies anymore, but research has found that it not only calms down the baby, but it also calms down the parent who's singing those songs. And then simple games, clapping games or dancing, movement can help. But I do want to put a caveat that interacting with the baby can be triggering for parents who are suffering with mental health conditions or symptoms. And so this won't work for everybody. It's always seeing what works. But I wanted to include them because we often tend to forget the baby in this picture. And we can, in this way, also help the baby and parents together. There is a lot of guilt and self-blame, though, so we need to always watch out that we're not saying things like, oh, you should play more games with your baby, or you should spend more time, because that's only going to exacerbate that guilt and blame. So empathy and compassion are essential, and fostering compassion in that parent can actually increase compassion with her child, which can act as a buffer for the child's development. This study had moms do a stressful task with their 3-year-olds, and they found that even if they had a more calming nervous system, so parasympathetic nervous system, then they were less negative and harsh. But also when they reported higher levels of compassionate love for their child. And the most interesting thing was that if moms had a high fight or flight type of stress pattern, but they also reported high compassionate love for their child, then they were less harsh and negative with their child in these stressful situations. So if we can foster compassion in the parent, then it helps her also to be more compassionate with her baby. So then, sorry, just checking the chat real quick. Also, we need to network and continually, of course, continue our professional development. We constantly have new opportunities. So I've done a lot of mental health conferences recently, and there are things in place or being developed, like an app that can provide mental health tips, for example. So there's continual movement in this area and more options. And we need to stay up to date, and we need to support each other. So now finally going on to Help Me Grow and what we do. So Help Me Grow, if you don't know us, we are a universal information and resource network that is free at no cost for parents or professionals. You can always call us if you need a resource for a family. So it's not on this slide, but it's for children 0 to 8. So if the parent is pregnant or has a child 0 to 8, that's when we help them in Spanish or English. We will not send anyone away, by the way. If they have a 10-year-old or a 12-year-old where they have concerns, we will still try to find them another resource, but we're not following up on those older children. We offer these different screening questionnaires for children, and we offer the Edinburgh postpartum depression screening for all perinatal parents. So we have parent support specialists who give the results of those screening questionnaires, and they do the follow-ups. They connect with the resources, and they do that through the phone, email, texting, or our new app, and that has the ASQ and ASQ SE, but no other screeners in there, but it has lots of parenting tips in there. And then our outreach teams continually connects with providers and finds new resources and stays connected with existing resources so that we can, again, strengthen that network around families so that we can help them even better. Around 2015 and 16, we worked along with the Maternal Mental Health Collaborative, led and originated by Amy Rose White, who is a fantastic therapist, perinatal therapist. She's doing a lot of other things right now as well. She's amazing. And if she does a presentation, maybe you've already seen her present on perinatal mental health, definitely take the opportunity. She's amazing. And she helped us create our protocol so that every mom who is expecting or has a baby up to 6 weeks old is offered to take the Edinburgh screener. And we offer it also when they are pregnant again, and they indicate that, or when they bring up any mental health concerns, or when they are referred by a community partner who wants us to do a screener with the parent. And we also offer them to any parent who calls who wants it. So we've done it with dads. We can do it with the grandparents. We could do it, if they ask. But yeah, it has been validated with women and men perinatally, so pre and postpartum, which is up to 1 year, but we do them sometimes later in the year too if they ask. So let me know if you have any questions about that. We have divided the scores between 0 and 4 to be no concern if there's no self-harm endorsed. 5 to 9 is kind of in the middle. We call it monitoring. And then if there's self-harm and or a score of 10 or more, we then call that a concern score. And our protocol depends on those categories. So we we'll check if they want to do it and if they're already taking the Edinburgh, which is more and more now, like it's more and more organizations are promoting screening. So you will probably also find that more and more parents are taking this screener with their child's pediatrician or with their OBGYN or their family doctor. But we do also ask if they feel enough supported by those providers, or if they want more resources and such, that you can still take it with us, but of course they choose. And then we call it a check-in on their emotional health. So a screener, that's not a term that all people know very well. And basically we do just want to check in how they are in their emotional well-being. We send it at least once during pregnancy and once postpartum, and more frequently if they want to or if they have concerns. We always thank the mom or parent for being vulnerable and sharing her struggles, because it's hard to do. It's not something we should take for granted. We also review what she needs, what she wants, and also what she already has tried, a resource she already has, support systems. We may do safety planning. And the link by DHHS I just shared has a safety planner on it. I will make sure to share these links with all of you. But yeah, we will just have conversation initially. And then we'll say something when the first time we offer it. Like, it's not easy to be a parent, and it's really important that we check in with your well-being too. So we would like to offer you this screener or this questionnaire. By the way, we don't have to necessarily do that verbatim. We want to keep it natural so that we can be authentic in connecting with that person. If there is a concern, we will always offer a second one. We will say, do you want to take it again? And then we will check in with you again. So if there's no concern, we will send the results back. We always will try to call the parent, but if not possible, we'll send it usually through email, and we usually will send a text to say like, hey, we sent your results back. We always do send this Sunshine or Bailando handout so that we can go over what works for that person, if in case they, everyone needs a reminder to take care of themselves, especially in that perinatal period. And then we will also share at Help Me Grow the results with the provider if they give permission to do that. Monitoring, we do the same things, but we do send more resources. Like, we always will send possible support groups, that maternal mental health referral website. There's always discussion with either me or a supervisor to make sure that we are pooling all of the resources and the knowledge here. And then we offer the rescreen about 6 to 8 weeks later, but if they want it 4 weeks later, then we'll do that, of course. And then if there's a concern, we will call as soon as possible. So we'll do it the same day if possible. If they don't respond the next day again, we will text as well, because that's usually they respond better to texting. Again, we will talk about the concerns, and we will talk about those potential self-harm concerns. We will create a safety plan with them, which basically is like, can you feel the symptoms coming up? What are the signs for that? What has helped you before? And if necessary, we will do a warm handoff to a crisis line. So yeah, of course, we will also send the 988 crisis number, and yeah, make sure to follow up as much as they want.
So, Ilse,
Yeah.
about a 10-minute warning.
Thank you so much. And thank you for unmuting, because I don't always see the chat. And that will work out. So I'll give some examples of actual cases. So we typically, so what we do is we have put the Edinburgh in Qualtrics. So then in the output, these are the comments that they can give at the end. So they can indicate, do they want to, who are they supported by? Do they want to list a provider? Any other questions, concerns? And then what would you like to receive resources on? So this first one says physical recovery, helping siblings to adjust to a new baby, infant massage. And do you want the Edinburgh again? So we can see that at first glance, which is really helpful. And then here's an example. Told by one of our parent support specialists, who are wonderfully informed and empathetic professionals, who always will take the time to listen and acknowledge that it is so hard, and they will also strengthen and emphasize the strength and protective factors as well. So this one, she had been very tired and overwhelmed, and she's in school, so she's trying to do school, and her husband's full-time working, but they live close to her parents, and her mom has been very supportive. So that's a positive. And then she had been struggling with breastfeeding, saw a lactation consultant, but it hasn't helped enough yet. So she wanted to have more information and concrete support with her physical recovery. that we could send her information on. Also, she has a hard time when the baby gets fussy, you know, around that witching hour of 5 p.m. And she's not sure if she's feeding him enough. She's talking to her doctor, but she's still kind of worried. And so it helped her to talk about that with us. And she also said that she loves to go out on walks, but it's kind of hard to do because it was cold and taking the baby out, you know. And so we talked to her about how maybe she could make that work if her mom or husband could help. And then she was getting emotional, but therapy, she said that would be just overwhelming to have to think about one more thing to organize. So this is actually pretty common that we encounter a lot. So she already had been working with WIC and actually done in Edinburgh, but she still found it helpful to do one with us. And we followed up with her weeks later. This one, we again try to emphasize social support, but some moms that we work with, they have no social support system, or their family members are very toxic. They just don't have anyone to really turn to. And in this case, luckily we were able to connect this parent to the nurse family partnership so that she got her support, professional support, but it's very warm and informed support. So that was really good. Of course, we're not always able to have such a success story. If there's no one that we can connect to, we always do try and encourage them. But if they only have one thing, then they have had us that listen to them, and that's already supportive. This one, she wanted to make an appointment with her therapist, but she had to call her insurance, and it was just all so much to oversee and so much energy. But because we checked, this mom actually checked in and was able to connect with a therapist. So yeah, gaps and barriers, like already mentioned by some of you, insurance limitations, financial challenges, childcare, transportation, your energy, your time. And having a baby can make it harder to start therapy, both because that baby takes a lot of time and energy, and also because parents want to stay usually with their babies, you know, maybe not leave them with someone else. It's just a challenge. And also often they feel like it's not important enough. And they're usually very pleasantly surprised when we ask about their well-being, because they will say, oh, I thought it was only for my child. And I'm like, no, you are just as important, you know, you need support too. And they feel very acknowledged and listened to. So yeah, social support, immigration concerns, there's many barriers. Often they're more motivated to seek support for their children. So it's really good that pediatricians are doing screenings now and checking in with parents. And then, yeah, we emphasize the listening, the empathizing, normalizing. And we check in if it still works for them, because maybe in a month or two, maybe they do want to have therapy and they may want different resources. We also want to say there's no wrong door, you know, wherever they start, wherever they do a screening, wherever they try to find support, let's all work together to support. And then make sure, again, that we show up interested, empathetic, as informed as we can, but if nothing else, just a listening ear is so valuable. And yeah, so we are seeing more and more of these community-based prevention as follow-ups, and I think that's a really good development. If you wanted to have parents take the Edinburgh with us, you can, and then we will follow up obviously with them. And so you have the details on that. And again, I'll share this so you can find it. And that was my presentation. So thank you very much for your attention. And I want to see if there's anyone who has any questions, comments.
I have a question, Ilse. How have you found therapists in the private therapy or at mental health? Have you found therapists who are open to the parent or the mom bringing the baby?
Yes, I have. And that's an excellent question. And that's actually something I don't think is usually indicated in like any search, you know, Psychology
No.
Today, for instance, they have an excellent website where you can search for therapists, but it doesn't usually say if you can bring your baby or not. And there was a clinic at St. Mark's, but it already closed again, where they specifically had
Oh,
that as a focus. But yeah, so it's just basically case by case. I hear sometimes, that they allow it or that they make a practice of it, but it's
yes, it would take that, therapist special training and working on that co-regulation and, but also, a parent may also, on the other hand, need to have that time to be alone to grieve and kind of, in some way, kind of come apart, before integrating, going back to the baby. But I just wondered how open you felt people in the community were for those kinds of things.
Yeah, I think the one thing that we can see is if they have been, so PSI International, they have trainings and certifications. So we can see when people have taken that perinatal mental health certification and training, but that doesn't really include that infant piece. And so, but the most of them that I've heard typically allow the baby to come in like maybe a few times or one time, but not all the time. Like you said, they need. Yeah. So thank you for that question.
Are there other questions for Ilse? Thank you, Ilse, for a great presentation.
Thank you.
If there's
was
any other
wonderful.
questions? Looks like Lupita put in the chat there. I know we collaborate together and the kids that go exit early intervention go to Help Me Grow. But can a family receive service from Help Me Grow along with early intervention services?
Yes, actually, thank you for asking that, Lupita. That's we often do that actually. So they may have older children too, but even the child that is currently in early intervention, many of them are already enrolled as well with Help Me Grow. And so, for example, they may do an Edinburgh screener with us, or they may say, I don't want to do ASQs because I'm doing them with EI right now, but they still want to be connected with us so that they can ask for resources or whatever they need. So yeah, that's possible.
So also I put in the chat the Help Me Grow Utah website link there for those who might want that. Ilse, are you sharing your slides with us, I would imagine, to put in the Canvas page? Is that?
Yes, I will share it. I just had a couple of links that
Yep.
some technical issues in getting all the links in so that you guys can find all those resources.
That's great. So they'll be in the Canvas page that we support with the Time to Act Mental Health Echo. Any other questions for Ilse before we move into the breakout sessions? Okay. Ilse, thank you again. You're welcome to stay on for this breakout session if you'd like. You're welcome to go if you've got other things. We're going to turn some time over to Shana now. She'll introduce our breakout session and we'll have a couple of groups that we'll have do that. Shana?
Thank you, Ilse. Thank you.
So my name is Shana Pugh, and I just kind of came up with a practice case scenario, so kind of involving perinatal mental health, so we could practice. Okay, so Sarah is a 28-year-old first-time mother who recently gave birth to a healthy baby boy named James. She is attending a postpartum checkup at a community health center where Alex, a nurse practitioner, is her primary care provider. And during the appointment, Alex notices that Sarah seems unusually withdrawn and less engaged compared to her previous visits. So during the checkup, Alex approaches Sarah with a concern for her well-being. Sarah, who has been experiencing significant life changes, shows that she is feeling overwhelmed, exhausted, and struggling to bond with her baby. She mentions feelings of persistent sadness and anxiety, though she downplays these symptoms as part of being a new mom. Alex recognizes that Sarah's symptoms might be indicative of postpartum depression, but also understands that Sarah might be hesitant to seek help due to stigma or uncertainty about her condition. Sarah is unsure if her symptoms are severe enough and is worried about the implications of seeking help. Alex explains that many new mothers experience similar feelings and that there are effective treatments available, and she offers Sarah a referral to a mental health specialist who has experience working with new mothers, as well as information about local mental health resources and support groups where she can connect with new mothers. Alex emphasizes that seeking help is a positive step and that continuing care and support are available, and she schedules a follow-up appointment to check on Sarah's progress and ensure she has access to the resources she needs. So for a discussion, we're just going to talk about addressing hesitation. If Sarah is feeling defensive or reluctant to discuss her mental health issues, how might Alex adjust the conversation? Additional support besides referrals, what other types of support or resources could Alex offer to help Sarah manage her mental health? And then handling decline, what strategies should Alex employ if Sarah decides not to follow through with the referral to a mental health professional? Okay, awesome. It looks like we have everyone back. So we're just gonna have each group just share one thing that they talked about during the breakout sessions. So is Tony here? Do you want to start with us?
Yeah, we had a really good conversation. We had a question from one of our participants, Nishta, on how to just support mothers who are dealing with postpartum and mood disorders. And we had a great discussion with Nancy, gave her a lot of good advice just about support and how to help those mothers.
Awesome. That's perfect. Let's see. Can we go to Stephanie?
Yeah. So Heather facilitated our conversation and I took notes, but there were some really good things and I don't know which one to share. But Adrina said that something that really stuck with me as someone that refers families to think of is to make sure that when they're getting informal supports, that they find people that match their culture or their values or their views so that it can normalize what they're going through.
Awesome. Yeah, I think that's really important across healthcare fields. So awesome. If you guys could just send whoever took notes, just send it to this email I just put in the chat, and then we'll get those compiled and put on Canvas. So.
Yeah, Shane, I'll put the email in the chat.
Oh.
So thank you to everybody who came and participated today. I loved Ilse's topic today. We've got 7 kids, and so I've seen some of those, what my wife called mood swings, but it was really enlightening to listen to Ilse. And thank you for those who have volunteered suggestions for the breakout session. I know that we all probably deal with moms and dads that deal with these things that we talked about today. So just a reminder, on the 16th of October will be our next session at the same time at noon. If you haven't done the survey, the link's right there. Shana just put it in the chat. So please fill out that survey. That helps us to be able to identify more data that we can utilize as we continue to try to be able to supply these sessions. So thanks to everyone who was on. Appreciate you. We'll see you next month.